Hi everyone, welcome back to Nurse Katherine here. As I promised yesterday, I would be recording another video and posting it the following day, which is today, about type 1 diabetes. Because I have not started my job here yet in Atlanta, I will be posting videos almost every single day on nursing related topics. Right now, we are going to go through a diabetes series, so if you missed yesterday's video, make sure you go check that out because those are the three main symptoms of diabetes, the 3 Ps, so go check those out. And today's video is talking all about type 1 diabetes. We are going to talk about what type 1 diabetes is, the treatment for type 1 diabetes, and nursing education for your patients. In type 1 diabetes, your pancreas does not produce insulin, or it produces a little amount of insulin. It is thought to be an autoimmune disease. So autoimmune means when your body attacks itself. So why does your pancreas not produce enough insulin? Well, the autoimmune part of it, your body attacking itself, the body attacks the beta cells that produce insulin. So if you're not having enough beta cells as it is, your body cannot produce the insulin to then bind with the sugar molecules to give your body the energy it needs. So that's why in type 1 diabetes, these patients have really high sugar levels, or they can have really low sugar levels. Now, a few symptoms of type 1 diabetes would be your 3 Ps that we talked about yesterday: polyuria, polydipsia, and polyphagia. But a big one for type 1 diabetes compared to type 2 diabetes is weight loss. And these patients have a weight loss because, remember, the beta cells are not producing insulin, okay? Insulin then normally binds to sugar molecules to then give your body the energy it needs to keep going every day. But when the insulin and the sugar molecules are not binding together to give your body energy, your body starts using fat stores instead to give the body energy. So a symptom of type 1 diabetes is weight loss, because your body is using fat for energy instead of sugar for energy. These patients can have weight loss an extreme amount in a short little of time. I had a patient one time in the ER who was newly diagnosed with type 1 diabetes, wasn't feeling well, was complaining of the 3 Ps, also had extreme weight loss, and I believe he said that he lost 30 to 40 pounds in 1 month. And of course, you know, what in the world is going on? Because he wasn't even trying to lose weight. His body was just losing it. Another symptom that he had that diabetics can have on either side, not just type 1, but is a symptom of type 1, is blurred vision. When you don't know that you have type 1 diabetes, you don't know your sugar levels are high. When your sugar levels are high, that starts to affect your other organs of your body and your nerves as well, causing nerve damage. But it starts affecting your eyes, and because of those high sugar levels, that can cause you to go blind if it's untreated. You'll get blurry, blind, and I have seen that happen to patients. So remember, those high sugar levels also can cause blurry vision. Now, treatment for type 1 diabetics is pretty unfortunate because these patients will always have to inject insulin or wear a pump on their arm or wear a pump on their stomach. I had a friend in nursing school who had one on his stomach. It checked his sugar for him and it gave him insulin as well. Since a lot of people with type 1 diabetes are diagnosed when they're adolescents or children, they have these really fun pumps. I don't know if you guys have seen them before. They're like animals, multicolored, all of that you just put on the back of an arm, and that will check their blood sugar or even administer pumps. And these pumps are getting more fancy and fancier as the years go on. I actually got to help a patient one time put her new sensor on, her blood sugar sensor on her arm, and that was really cool. It kind of was like a staple gun almost, if you want to say that. And she's like, yeah, I'll just put my arm up, and I put it up to her arm and I just kind of pressed the button and it just latched right on, which is really nice because if you don't have a continuous blood sugar tracker, which you actually can track on phones as well, which is really cool, and technology is amazing that it allows that, but you would have to poke your finger probably 4 times a day. Breakfast, lunch, dinner, and bedtime, all dependent on what the doctor's order is, but those are the most typical orders that I have seen. Always giving insulin at breakfast, lunch, then dinner, and also at bedtime. Again, every patient will be different because everybody's diabetes is totally different. Some people are very brittle diabetics, which if you hear that term, that means their sugars can be up high at one day and then down in the 40s the next day. And remember, a normal blood sugar is between 70 and 100. So if you do have a brittle diabetic patient, make sure you listen to them because they really do know their body and they know what they need to be doing. But that is the overview of type 1 diabetes, guys. Make sure you stay tuned for tomorrow's video because we are going to go over type 2 diabetes. All right, thank you for watching and I will see you guys tomorrow.